A patient rushes into your clinic with broken tooth in her hand. And what would you do about it? So here's a case where a 45-year-old female rushed into the clinic with broken tooth in her hand. She fell off the stairs and the tooth broke. But luckily, she reported to the clinic within 2 hours of the fall. So what we did next will give you a detail about fragment reattachment. Points that favored reattachment here was patient came early, which is within 2 hours, and the tooth was not broken into multiple pieces. It was broken off into a single piece. So now I took the tooth, placed it in chlorhexidine solution so that it gets disinfected. Then I came to the patient, and what I did was, she was obviously in pain, so I had to give her some local anesthetic. And once she got stabilized, I checked her bite, and there came a shocker. The patient had typical reverse bite, where her mandibular incisors were ahead of her maxillary incisors. And that is why when patient fell, her lower tooth broke. It's usually the upper teeth that break, but because these were ahead, the lower tooth broke. The fracture was luckily horizontal, and the fracture line was almost straight. So we went ahead, took the x-ray. There was no periapical lesion, so that gives a clear sign. I went ahead and did root canal for the patient, but I operated only to the apical third and did a sectional obturation. And on top of that, I plan to place a fiber post and reattach my fragment. So how would I go about doing this? For fragment reattachment, I need to make a drill in my broken fragment, and the drill size should exactly match my fiber post size. So now I need two types of customizations. One is my drill bit size. You can go about with the tapered flat or tapered round burr. But before doing a drill in your teeth, it's better to take the impression of your burr in a small silicone mold. Once you get the impression of that, now you need to customize the top end of your fiber post. To make the customization, it is important for you to access the length of your remaining canal, that is your fiber post length, and the length of the drill you would be doing in your crown. Because we are dealing with natural tooth, you cannot give space for errors here. You cannot repeat the crowns here. It's the natural tooth of patient that you're trying to stick back on the tooth. So it's important to be very precise here. So you place your burr on the natural. Measure how deep your retention hole is going to be. Mark it on the burr, mark it on the tooth, and then you put back your tooth. The important part here is that we modify the top end of your fiber post. You'd shape it, trim it around so that it exactly seats on top of your fiber post. So now the whole length should be exactly as you've marked. Be very precise. Once that is done, you check the snug fit with your fiber post. When there is a snug fit, then that means your preparation is proper. Now we go ahead with bonding of our fiber posts. You dry the canal, you can irrigate with chlorhexidine. So if you irrigate the canal with chlorhexidine, there's better bonding to the fiber post. Then you put your gel cure resin cement and then place your fiber post, and that's when you cure it. Once you cure it, the top surface, there is an overflow of your composite. So you remove the entire composite overflow. Apart from that, you will also finish the margin of your root. You'll finish the margin of your broken tooth. That you would do without using a burr. You can take your polishing kits, your rubber cups, your brushes, but make sure there's a smooth surface for bonding. Now, once we get smooth surface on the roots as well as your tooth, you start with your bonding protocol, where you etch with 37% phosphoric acid, dry, then bond, and then place again your gel cure on top part of your fiber post, inside of the hole that you've just drilled, and on the surface of the root. When all these surfaces are filled with gel cure resin, you gently place the tooth on top of your fiber post. And when it fits properly, that's when you're going to cure it. Always recheck it with an x-ray. Once you've placed it before curing, just see if there's proper flow of the cement everywhere, and see if your tooth is seating in occlusion, no proclination or no rotations that you've induced. Because any minor errors here can make your tooth fit wrong. And now you have to go about with the crown. Your entire attempt to save the tooth would go in vain. So be very careful when you're trying fragment reattachment. The most important protocol here is isolation. Always do this under rubber dam isolation. Imagine I do a root canal, place fiber post without rubber dam, and I place the crown back on it. We are infecting the canal. Saliva is active in that environment, and that will create a bond failure. Now, if the bond fails, there is no point if I attach the tooth. We're going to extract it later. So once the reattachment is done, now I polish the tooth, clean it properly, then apply a resin coat so that my bond is protected, and I sent the patient back. The patient was really happy that she walked out of the clinic with her own tooth reattached within an hour. So fragment reattachment is a procedure that would give a lot of satisfaction to the clinician for saving patients' tooth, and it builds trust in your patients. So next time if you face such situation in your OPD, you know how to handle it. And being aware of this procedure can help you save a lot of time in your OPD and build confidence in your work. So try to practice it and try to be a conservative dentist. Thank you. Hi, I'm Dr. Sahiti. I hope you found my video informational. And if you want to see more such videos which are case-based, then please do subscribe to my channel, which I give down below. You can also follow me on my Instagram. And please do hit the bell icon so you can get a notification whenever I upload a new video. So looking forward to learn more with you, share my experiences and learn from your experiences. Please do comment whatever you feel, give us updates, and let's keep our dental community alive and thriving. Looking forward to learn more. Bye bye.